8 signs an elderly person may be in their final year. The final year of life often announces itself in subtle, distinct red flags. Ignoring these signs can mean missing a critical window to seek help and provide comfort. Research shows many older adults aren't warned when death is near, leaving families unprepared. Let's uncover 8 scientifically backed signs that an elderly loved one may be approaching end of life, and why you must not overlook them. 1. Sudden, significant weight loss. Unexplained weight loss in a senior is one of the clearest warning signs that something is very wrong. A 2023 study in JAMA found that losing just 5 to 10% of body weight in old age boosts mortality risk by over 30% at higher risk in men, 20 in women. More drastic loss, and hurt was even deadlier, nearly tripling death risk for men and doubling it for women. Doctors define significant weight loss as loss of body weight within 6-12 months, and it's consistently linked to higher odds of death and serious illness. Such weight loss often isn't intentional. It can signal cancer, organ failure, or the body's inability to absorb nutrients. Don't dismiss a suddenly baggy wardrobe or a shrinking figure as just aging. In one hospice timeline, noticeable weight loss was observed in the last few months of life. This barren red flag screams that the body's reserves are dwindling. Take it seriously and seek medical evaluation immediately. It could give your family a chance to address underlying issues or begin palliative care early. 2. Extreme fatigue and weakness. When an elderly person is exhausted all the time, too weak to get out of bed or do things they used to enjoy, it may foreshadow the end-of-life decline. We're not talking about needing an extra nap here or there. This is bone-deep, persistent fatigue that doesn't improve. Research shows a strong link between unrelenting fatigue and mortality. In one study, 59% of older adults who said they were tired most of the time had died within 10 years, compared to 30% of those without chronic fatigue. Even after adjusting for other health problems, being frequently tired carried a 44% higher risk of death. Hazard ratio 1:4. Fatigue is a core component of frailty syndrome, and frailty dramatically increases risk of dying. Geriatric specialists warn that exhaustion, often coupled with muscle weakness and slower movement, is a red flag that the body is losing its ability to recover. In fact, fatigue and generalized weakness are among the 5 most prevalent symptoms in the last year of life for seniors. If your loved one is sleeping far more than usual, struggling to hold their head up, or too weak to walk to the bathroom, do not ignore it. This extreme fatigue often means their heart, lungs, or other systems are wearing out. It's a cry for help. Time to consult a doctor about underlying causes and consider extra support or hospice services. Noticeable cognitive decline or confusion. Subtle changes in memory and cognition can be easy to write off. She's just getting forgetful. But rapid or marked cognitive decline in an elderly person may signal they're in their final chapter. Researchers have found that seniors with new or worsening confusion, memory loss, or disorientation often have limited time left. Rapid cognitive decline is associated with a sharply higher risk of death. One longitudinal study noted it predicted a 70% higher mortality rate. Another found that for each unit drop on a cognitive test, the risk of death jumped by 90%. In fact, analysts concluded that sudden worsening of cognition can be a marker of impending end of life. This means that when an older adult suddenly seems much more confused, forgets familiar people or places, or has episodes of delirium, the body may be entering a terminal decline. Family members often overlook this or assume it's just dementia progressing. Tragically, overlooked mental changes can mean the person doesn't get timely end-of-life care. Watch for signs like getting lost in their own home, forgetting names of close family, repeating questions, or hallucinating. In the final weeks, confusion often worsens. Hospice doctors report that extreme fatigue, confusion, and social withdrawal become pronounced as the end nears. If grandpa is suddenly talking gibberish or mom doesn't recognize where she is at times, don't brush it off. It could be a silent alarm that life is nearing its end. Engage a physician or neurologist to evaluate the change. It may be time to emphasize comfort and safety. 4. Frequent infections or slow recovery from illness. Recurring infections, like frequent bouts of pneumonia, urinary tract infections, or infected bed sores, are silent signals that an elder's immune system is failing. If your loved one seems to get one infection after another, or minor wounds won't heal, pay attention. Infectious disease experts note that infections already account for a huge share of elderly deaths. 1/3 of all deaths in people over 65 are due to infectious disease complications. For example, a whopping 90% of pneumonia-related deaths occur in seniors. So, when an older person begins catching infections repeatedly, it's often a red flag that their body can no longer fight off illness effectively, a common issue in the final year of life. Even the signs of infection are subtle in elders. They may not get a fever. Instead, they just become weaker or more confused. Case reports show that families sometimes miss these clues. What they think is just a cold or another UTI could actually indicate an irreversible decline in the immune system. Hospice physicians warn that in the last months of life, patients have an increased risk of infections as their strength wanes. If grandma has had pneumonia twice this year, or dad's on his third antibiotic for recurrent UTIs, don't take it lightly. These infections can be deadly in a frail elder, or they may be signposts that the end is approaching. It's crucial to involve medical professionals to manage these infections aggressively and discuss whether hospice care, which can provide comfort and prevent futile hospital trips, is appropriate. Frequent infections are the body's SOS. Respond with urgent care and compassion. 5. Changes in breathing or circulation. How an older person breathes and their circulation can reveal that the body is shutting down. You might notice new breathing issues, shortness of breath, wheezing, or periods of breathlessness even at rest. Perhaps they now get winded walking across the room or breathe fast and shallow while sitting. Don't ignore such changes. Chronic breathlessness in elders strongly predicts earlier death. In a 10-year study, 60% of older adults who felt persistently breathless had died, versus 40% of those without breathing trouble. Even after accounting for other diseases, difficulty breathing was an independent risk factor that more than doubled mortality risk. Why? Symptoms like dyspnea, labored breathing, often indicate underlying heart or lung failure. Think congestive heart failure or advancing COPD. Conditions that mark the final life stage if they worsen. Likewise, watch the person's circulation and vital signs. As the end of life draws near, doctors note that blood pressure often drops, the pulse may become weak or irregular, and circulation to the limbs diminishes. Hands, feet, and legs might grow cool to the touch or develop a purplish, mottled, blotchy coloring. These are silent but critical red flags that the heart is no longer pumping effectively. In the final days, such circulation changes, along with irregular breathing patterns like Cheney-Stokes respirations or the death rattle in the throat, are telltale signs death is imminent. But even on the scale of months, new oxygen needs, repeated choking/coughing episodes, or constant dizziness from low blood pressure should set off alarm bells. Action step: get medical evaluation for any new breathing difficulty or circulatory change. It could mean medications, for heart failure, for example, need adjusting. Or it might be time to implement comfort-focused care. When an elder's once rosy hands turn cool and bluish, it's a silent alarm that time may be running out. Don't overlook it. Chapter 6. Marked decline in mobility and function. Frailty. Has your loved one stopped walking to the mail? Are they falling frequently or becoming unable to get out of a chair without help? A sudden or steady decline in mobility, balance, and daily function is a red flag that the end of life may be approaching. Geriatric experts refer to this as frailty, a syndrome of dwindling strength, slow movement, and exhaustion. It often accelerates in the last year of life. In practical terms, you might see an elder go from using a cane to a walker and then becoming mostly bedbound within several months. They may struggle with basic tasks, dressing, bathing, that they handled before. This level of functional decline strongly correlates with mortality. For instance, the clinical frailty scale shows that very frail older adults, those who are completely dependent, have dramatically shorter expected survival. One study found the most frail patients averaged only 219 days of life remaining versus 365 days in fitter peers. In plain English, when an elderly person's body becomes frail and shuts down physically, the clock is ticking. Often families overlook these signs by simply accommodating them, getting a hospital bed, hiring home aides, without recognizing why the decline is happening. Pay attention to failure to thrive, weight loss, weakness, and decreasing mobility altogether. Doctors find that when older patients meet several of these criteria, the risk of death within 6 to 12 months is very high. If Grandpa, who was gardening last summer, now can barely stand, it's a blunt red flag that shouldn't be ignored. Intervene by consulting a geriatrician for a frailty assessment. Physical therapy, better nutrition, or assistive devices might help temporarily. But equally important, the family should prepare for end-of-life needs. Frailty is often the final pathway that many illnesses funnel into. Recognizing it gives you a chance to ensure comfort and plan for what's coming. 7. Social withdrawal and detachment from life. Watch for a grandparent checking out from the world. An early but easily missed sign of impending decline is an elderly person withdrawing from social interactions and activities they used to enjoy. It may happen so quietly that you chalk it up to mood or age, but it can signal that they sense the end of life is nearing. In a Swedish nursing home study, staff observed that many residents who were approaching death began going into a bubble, showing less interest in the outside world and wanting to be alone. Someone who was always sociable might start refusing visits or phone calls. A grandma who loved watching her game shows may now sit in silence, uninterested in TV or news. One caregiver gave an example of an avid football fan who suddenly didn't care about game results anymore. This kind of detachment and apathy can be an early red flag of decline. It's often coupled with increased sleep and low mood. Hospice experts note that in the month or two before death, emotional changes emerge. Patients become more withdrawn, less communicative, and introspective. It's as if the person is slowly letting go of their attachments to this world. Families sometimes don't realize this can be a symptom of a medical decline, not just depression. Of course, not everyone who withdraws is about to die, but in the context of other health issues, it's concerning. Take note if your loved one is saying no to seeing the grandchildren, isolating in their room, or disengaging from hobbies. They might also speak more about past memories than present or future plans. These are blunt signals of psychological preparation for death. The compassionate response is not to force engagement, but rather to ensure they aren't withdrawing due to untreated pain or depression. Gently let them guide the pace. Importantly, alert their doctor. This degree of social withdrawal alongside physical decline may mean it's time for hospice or counseling. Don't just assume they're cranky or tired, recognize it as possibly nature's way of turning inward as life ebbs. 8. Depression, anxiety, or emotional distress about dying. Along with social withdrawal, profound changes in an elder's emotional state can foreshadow the last year of life. It's frightening yet critical to acknowledge signs like new onset depression, heightened anxiety, or even remarks about not wanting to live anymore. As health fails, many seniors experience grief, fear, or a sense of coming closure. In fact, end-of-life anxiety and depression are not uncommon as a person becomes aware, consciously or not, that time is short. You might notice your loved one becoming unusually irritable or hopeless. They may talk about feeling like a burden or express fears of what's to come. On the other hand, some exhibit a kind of peaceful acceptance. They might start giving away possessions, apologizing for past things, or even planning their own funeral. These psychological shifts are important red flags. In one qualitative study, a common early sign of dying was a low mood. The person grows quiet, lets others make decisions, and shows signs of depression or resignation. They might literally say they don't have fun anymore, or even directly state they're ready to go. Families must walk a fine line here. It's natural to reassure, oh, don't talk like that, but take such statements seriously. Terminally ill individuals often have episodes of what's called anticipatory grief, or even transient rallying and clarity, where they settle unfinished business. Pay attention if an elder suddenly wants to talk about heavy topics. They may be sensing the end. This is a time for urgent compassion. Involve a mental health professional or hospice counselor who specializes in end-of-life conversations. They can help address depression or anxiety. Sometimes medication for anxiety or spiritual counseling can ease this phase. Most importantly, listen and validate their feelings. An emotional storm or a calm surrender, both can be silent indicators. Death is drawing closer. Don't leave these psychological red flags unacknowledged. Use them as an impetus to ensure the person's emotional and spiritual needs are being met in their final journey. Why you should never ignore these signs. Each of these 8 red flags, weight loss, fatigue, cognitive decline, infections, breathing changes, functional decline, withdrawal, and emotional changes, is a cry for attention. They are the body's and mind's way of signaling that the end may be near. Overlooking them out of fear or denial can rob your family of precious time to prepare and to make your loved one comfortable. Medical experts and hospice specialists agree that acting early can greatly improve an elder's quality of life in their final months. For example, recognizing these signs could prompt a frank conversation with a geriatrician or palliative care team. Hospice care, which many delay until the final days, can be started months earlier to manage symptoms and support the family once it's clear that curative treatments are futile. Do not wait for a crisis. If you see 2 or 3 of these signs together, treat it as an emergency to consult healthcare providers. As frightening as it is to acknowledge, facing these red flags allows you to take urgent action, get proper pain control, arrange for hospice nurses, mend family rifts, and ensure your loved one's wishes for end-of-life care are honored. Remember, these signs are not always loud. They can be silent, creeping changes, a skipped meal here, a lost word there, but together they paint a picture. That picture may be telling you that your loved one is in their final year of life. Respond with open eyes and an open heart. Your vigilance and compassion can make all the difference. By heeding these warnings, you can spare your loved one unnecessary suffering and give them the gift of support, dignity, and love in their last chapter. It's never easy, but it is crucial, and someday you'll be grateful you took action when you did.